At the onset of the pandemic, people avoided going to the dentist.
Dentistry got hit pretty hard for all my colleagues in Belize and across the world.
Patients canceled appointments for fear of contracting the virus.
I recall when the former Prime Minister at that time, he announced the first case and the phones here started to ring, and we had mass cancellations. People were in a panic.
But as the world learned more about the virus, dentists also learned and adapted.
We always have universal precautions when we practice. Sterilization protocols, masks, goggles, sterilizing all our areas. But when COVID came in, we had to then incorporate face shields and PPEs, to keep ourselves safe, because people were afraid to come to the dental office.
Soon enough, people began returning to their dentist. But after months of being away, oral diseases worsened. Dr. Heusner says people's behaviors are changing in the pandemic.
We are seeing a little more decay because of the wait in time. People are not coming in every 6 months to do their regular checkup. But an interesting fact here, when COVID hit, kids were not going to school. So kids were staying at home all day. And what happens when kids stay home all day? They're eating more. They're eating more junk, they're eating more sugars, more juices. And so I'll say yes, we'll probably see more decay. Also, habits have changed, especially among the teenagers. Instead of going to bed 9, 10, going to bed at midnight snacking. So all that has changed the outlook, of where we are.
Practicing proper oral hygiene and taking regular visits to your dentist can help to prevent these oral complications. And believe it or not, rinsing with hydrogen peroxide can also decrease the viral load in COVID-19 positive patients.
When our patients walk in here, we have every patient rinse with, we use a combination of hydrogen peroxide and chlorhexidine gluconate. Now, this has been proven to reduce viral load in patients orally. So, and I'm not saying just to do it here. You can do it as a regular at home. You can rinse morning and you can rinse in the evening. Chlorhexidine gluconate, some pharmacies require a prescription for it. Locally, I know Odent brand. You can get that locally. We bring in ours, but it's very effective. The studies have shown that you can reduce viral load up to 45 minutes from about 60 to 70%.
Reporting for News 5, I am Paul Lopez.